Why does public health release the locations of some outbreaks and not others?
So when we receive a case of COVID-19, we look at their potential contacts with others where they might have acquired the virus, and sometimes that leads us to determination that the spread might have occurred in a particular setting, and then that's why we call it an outbreak. From our perspective, we routinely do not release the names of all sites where there's outbreaks declared for the reasons that releasing this information could lead to identifying of an individual. And it would contravene the privacy legislation, something that we are obligated to maintain. And the only exception to this is settings that are otherwise subject to mandatory reporting by the province, and that's long-term care homes as well as schools. But in terms of other workplaces or institutions, there are not. We do not have the mandate to report. The only reason why that might be sometimes approached differently is when, during the course of our case contact management, we identify that someone who might have been in that particular setting might be a close contact of many other individuals that we cannot reach directly, or we don't know everyone who that person might have been in contact with. That is something that leads to the public announcing of an outbreak. So those individuals who are at risk are aware of that, and they can take appropriate steps. On the other hand, when in the course of our investigations, we can reach out to all the individuals involved, and all the high risk or low risk contacts are notified of what steps they need to be taken, and we are reassured that we've reached out to everyone, then that does not require public reporting.